Governor Gina Raimondo announced last month that antibody tests have arrived here in Rhode Island. These are the tests that detect virus-fighting proteins in the blood of people who have had COVID-19. And we've been getting a lot of questions from you about them. Patty asks, when will antibody testing begin in Rhode Island? Well, Patty, right now a team of people is working to determine how the state's 20,000 antibody tests will be used. But first, researchers are going to be working over the next few weeks to ensure those tests are accurate. I spoke with a local doctor who's helping to lead that effort here. With testing for COVID-19 still limited in Rhode Island, health leaders are hopeful antibody tests will paint a fuller picture of how widespread the virus actually is.
We need to begin to get an understanding of just how many people in the state of Rhode Island have been infected.
But before that can happen, health professionals need to know if the test works. Dr. Angela Caliendo of Brown and Lifespan is co-chairing a team of researchers working to do just that. She says an accurate test is key in helping state leaders determine what's next. And a large number of false positives could skew those decisions. So first, they need to test the test.
To do a good specificity study, which is to ensure that there aren't a lot of false positives, you need a large number of samples. We're probably going to have to test 1,000 patients that were not exposed to the virus. And the best way to do that is to go into the freezers in the clinical laboratory and take out specimens that were collected on patients before COVID even started. So back in the fall, last summer.
Caliendo says they'll also use blood from people who've tested positive for COVID-19 at least 2 weeks ago, since she says it takes that long to develop antibodies. These new tests will not replace current testing being done to identify active COVID-19 infections. They're meant to identify people who have been infected, but they can't promise patients are no longer contagious or immune to COVID-19.
Some infections, antibody protects you from getting infected again. We do not know if this is the case for COVID. An antibody test is not a get-out-of-jail-free card. You still have to be just as cautious as you would be if you either didn't know your antibody status or your antibody status came up negative.
Another team is looking at how the tests will be rolled out and determining how the state can best get a random sample. Caliendo says the validation process could take a few weeks.